Do you guys remember that awesome schistocyte video? Well, it's going to come in handy now. 22-year-old male, college athlete, admitted to the ICU. Woo, we made it to the ICU. Just kidding, it's not a good thing. Collapsing during the summer track event. Witness reported that he's been sprinting at 38. Wow. Wait, oh, I was like, my guys are in 38 miles an hour. I don't know, I'm crazy. That's a fever, folks. He's got a fever. Shortly afterward, he becomes confused and vomits, and paramedics have a tonic-clonic seizure. I'm sorry, this intro has been so unhinged. On arrival, he is unconscious and profusely sweating, okay? So his vitals, oh my goodness, look at that vital. So, all right, we have heat stroke going on here. We totally have heat stroke. That would be a core body temperature that exceeds what? 104, and multi-organ dysfunction. All right, our blood pressure 85, heart rate 138, and resting 24. And let's look at this stuff. Ooh, okay, hemo is fine, kind of nice. Look at that. Look at those platelets though. Ooh, I'm gonna highlight on the left side because it's low. Look at those PT and PTT. Okay, so we should be forming some ideas in our mind. We get extreme heat and damaged tissues and hypoxic, like tissue injury, ischemia is happening. These damaged tissues are releasing what? They're releasing the tissue factor, and what is that going to activate? The extrinsic pathway of coagulation. What is that going to lead to? Excessive thrombin and fibrin formation, and widespread microthrombi are going to form in the small vessels, and consumption of the clotting factors in the platelets will occur, and secondary fibrinolysis will cause elevation of what? Say it all together. The D dimer is markedly elevated. This makes us think of consumptive coagulopathy. Boy, that is hard to say sometimes. DIC. Oh, we did it. So what are you going to see in this DIC patient? That is now the question. It makes you work for it, right? It makes you be like, okay, you got all this far, but now what? And so widespread fibrin microthrombi shred red blood cells as they pass through the shredder. We have a video on this. Watch it and you'll know the answer. Schistocytes, fragmented red blood cells appear on this peripheral smear. They're hallmark signs of what? What? Yes, that's right. Microangiopathic. It's like we're Blue's Clues, but for like 27-year-olds. Hemolytic anemia. Yeah, and that's also part of the DIC. So microangiopathic hemolytic anemia, TTP, and also HUS, and also DIC. Schistocytes, fragmented guys. Yeah, great. Atypical lymphocytes. What would those be seen in EBV, Epstein's-Barr virus mononucleosis? Hypersegmented neutrophils. What would that be seen in? Megaloblastic, that's B12 and folate. Not the acute guys. Teardrop cells, that'd be like your myelofibrosis or bone marrow, your bone marrow infiltration, not DIC. Target cells, liver disease, thalassemias, HBC, not relevant. Okay, heat stroke causes DIC, guys. I don't know what to tell you. We'll see you in the next video.